Alright, today I'm going to be doing a baby assessment. And to begin, we would take the baby's vitals. We would make sure we would take the blood pressure on both the arms and the legs. And for the systolic, the blood pressure should be between 65 and 95. And for the diastolic, it should be between 30 and 60. We're going to listen to the apical pulse for 1 full minute. And the heart rate should be between 110 and 160. Temperature 97.7 to 98.9. Respirations should be between 30 and 60. Then we're going to check polydactyl, and that we're going to make sure it has all its little fingers and toes, and this baby does. And then we're going to check for syndactyl, and that's going to be any webbing, and the baby does not have any webbing in its fingers. Then we're going to look for the Simeon crease, and the Simeon crease is a deep straight line across the hand, and if the baby has it, then it is a good indicator of Down syndrome. We're going to check for APGAR. APGAR assesses the heart rate, respirations, muscle tone, and color. If the baby scores a 7 or above, you need to monitor. 6 to 4, you need to stimulate the baby. And if it's 3 or below, you need to do a full resuscitation. Then we're going to check for acrocyanosis, and that is bluing of the hands and feet, and this baby does not. We're going to check the baby's head. The anterior fontanelle is going to be a diamond shape, and it closes between 12 and 18 months. And then we're going to check the posterior fontanelle, and it's going to look like a triangle, and it's ossified by the 2nd month. If the baby has sunken fontanelles, it's going to represent dehydration, and if the baby has bulging fontanelles, it represents hydrocephalus, and we will want to put the baby in a semi-Fowler's position. Next, we're going to check for stork bites. Stork bites are flat, pink patches that appear on the face, and they gradually fade. And then we're going to check and see if there are strawberry hemangionia, and that is dilated capillaries. They're harmless and they disappear without treatment. We're going to check for port wine stains, and those are flat red-purple lesions that don't blanch. Mongolian spots, they're dark blue or gray on the lower back and will usually disappear. You need to go ahead and chart it, so when you look back in the charts you won't suspect child abuse. The harlequin, we're going to roll the baby to the side, and it's going to be like a deep red color over the upper half of the body, and if you change the position you can also check for that side. The vernix is a cheese-like substance that protects the skin, and you're going to make sure you're going to wipe that off when the baby comes out. Milia are white pimples on the face, but you need to make sure you tell the parents not to pop them, they'll go away. Epstein pearls are pearly white pupils in the upper palate, and they're easily mistaken for milia, which is milk. Is milk secreted from the neonate. It is normal. It's a palpable mass of tissue of 5 millimeters or more. And when you're checking inside the mouth for Epstein pearls, you can also check to see if the baby has a cleft palate, and it'll be obvious if your baby has a cleft lip, and this baby does not. The umbilical cord it has 2 arteries, 1 vein. The artery carries the blood away, and the 1 vein returns the blood. Wharton's jelly cushions the cord and keeps the 3 cords separate, and it allows movement and stretching. You're going to assess your baby for respiratory distress. First, you're going to look for cyanosis, flaring nostrils, chest retractions, grunting, and you're going to check the respiration rate, the heart rate. Then next is going to be the caput succedaneum, and that's swelling of soft tissues of the scalp. and it crosses fontanelles. Cephalohematoma protrudes beneath the scalp. Molding allows fetal head to go through the birth canal. Reflexes, the gag reflex, we're just going to stick our finger inside the baby's mouth. The baby should cough, and the baby should also begin to start sucking on your finger, and that is also a good time to check to see if your baby has a cleft palate. Moro is when you startle the baby and its hands go out and then they come in. Babinski, you're going to stroke the side of the big toe and it should dorsiflex. Tonic neck is when your baby turns its head to one side, and the side that the baby's head is turned to, those arms will extend while the opposite side will stay flexed. Rooting is when you touch the side of the baby's cheek, and that baby will turn its head to the side that you touched, looking for milk. Hip clicks. They're audible clicks heard on when a baby's hip is being examined. You'll check for gluteal folds, and their asymmetric gluteal creases. They may be a sign of hip dysplasia. Surfactant coats the alveoli to help prevent the collapse and to prevent respiratory distress. There are 3 shunts. The ductus venosus diverts blood away from the liver. It closes when the cord is cut and permanently after 1 week. The ductus arteriosus diverts blood away from the pulmonary artery into the aorta. It functionally closes at 15 hours, permanently in 3 weeks. The foramen ovale, it diverts blood away from the right atrium to the left atrium rather than the lungs. It functionally closes in 2 hours and permanently in 3 months. The methods of heat loss, evaporation, we're going to dry the skin. Conduction, we're going to put a blanket down on the counter before we lay the baby down. Convection, we're going to make sure the warmer is on so the baby will stay warm, and we'll also wrap the baby in a blanket to keep heat and put a little cap on his head because the heat comes out of the head when they're born. Convection, radiation, we're going to keep the baby away from the walls. Breast milk has more antibodies than formula and it's preferred over formula. In a premature baby, the skin will be clear and transparent, and it'll have a lot of vernix. In boys, the genitals is not distended, and in the girls, the majors don't cover the minors. In a mature baby, the nipples come out from the body, and a premature, the nipples don't come out. In a post-term baby, the skin is thin and loose. The posture, the baby has a frog-like posture. Square window is when you bend the wrist to see if it's a square. And premature baby, the fingers go all the way touch down to the wrist. It does not make a square. Arm recoil is where you pull the arms away and they retract back. A preemie doesn't. Popliteal angle is the angle of the bent knee. The premature baby, it will not bend. Scarf sign, you're going to bring the arm across the chest. If in a term baby, it'll stop in the midline. Preterm baby, it'll go away all the way across the chest. The heel to ear, if